More on systemic type interactions. Some of the products that are going to be presented, Uline actually sells and supports. It's kind of a newer way of thinking, a way that as periodontists and as Academy of Perio, we've been trying to promote for a long time, but it's a slow process to get into the medical field, into the patient's head, et cetera, et cetera. So, Ms. Shirley Gutkowski, right? Okay, Ms. Shirley Gutkowski. Okay, make sure I said it right. The one that said it. She is a hygienist. She's a nationally known speaker. She writes for RDH Magazine. She's on her way to another big meeting, and she was kind enough to stop over and lecture for us. She is extremely qualified. I have not personally heard, but I've heard very good things about her lectures. So I want you to please welcome her into the attention and ask any questions. They're very good, Ms. Shirley, and you'll find a lot of questions. And we want to thank her for coming, and please enjoy, and I will see you next time.
Thank you very much. Well, if you have questions, I've got plenty of answers. Some of them may be right. So that's how we're going to start this lecture. I hope the dinner is good. I have a very short leash, so I don't know what we're going to do about that. It may be that I just set this down and put it aside and just talk really loud. So my name is Shirley Gutkowski. You may have seen my picture or seen my name in some dental or dental hygiene magazines. The name of the course today is Perky Perio. I have been avoiding speaking about periodontal disease because the market is so full of periodontal speakers. And to me, it seems not to offend anybody, but they're kind of dull. So I've been speaking now for quite some time, and I thought, well, maybe I could add some personality to periodontal disease discussions. And what shall I call this course? I shall call it Perky Perio. So that's what I did. So I hope that I can accommodate the needs for some kind of level of entertainment at the end of the day. I'd like to draw your attention to this slide. Did you know that we had 10 to the 14th cells, number of cells in the human body? Did you know that only 10% of those cells are mammalian cells? We are covered in germs. We are covered in bacteria, we're covered in yeast, we're covered in other kind of vegetative cells, we're covered in viruses. Just 10% of what's standing in front of you today is a mammal. The rest of it is, well, we won't go that far, is something else. I'd like to talk to you a little bit about how I kind of got here. I've been a clinical dental hygienist since 1986. So you can do the math and it comes into being a big number. In about 1997, it came to my attention that periodontal disease was linking strategically and in the medical literature to systemic issues. We've known about it in periodontal circles, we've known about it in dental hygiene circles. I graduated in 1986, like I said, and it was part of my education that the mouth was attached to the body. Did you guys all learn that too? What happened when we got out? It just kind of goes away. You just get into the grind, and then all of a sudden you forget. And what happens too is that if medicine doesn't know it, it isn't true. So we've just kind of gone on and on in our merry way cleaning people's teeth. And in the meantime, the researchers in medicine started to look at some of the research we were doing in periodontal medicine, and suddenly it started to show up in the medical journals, which is when I started to really look into this kind of approach. I'm sure I had the same kind of patient that you had. He would come in every 6 months because he wanted to. He would have 7 and 8 millimeter, excuse me for the language, pussy-ucky pockets. Big bleedy 7 and 8 millimeter pockets all over the place, and in big red letters across the chart, do not discuss periodontal disease with this patient. What do? Because you want it to come back. I'm freaking we have a happy hygienist. I wouldn't want you to come back. Everything's going to be good. But you're swimming in blood. Do you know, who was around before gloves? Okay? So there's a couple of us that were around before gloves. But then when you started wearing gloves, and then you get one of these patients, don't you change your gloves a couple times? Yeah, because it's like disgusting. So here I am changing my gloves, and I'm not telling this patient that they have periodontal disease. And it just got to be too much. So one day I sat him up and I said, Bob, or whatever, I said, I can't do this anymore. I said, you have periodontal disease and it is bad. We're not talking about a little bit of bleeding here. You have bleeding, you have an enormous amount of bone loss, you have an infection that's affecting your entire body. You are at higher risk for a cardiac event. You're at higher risk for a stroke, and if you were a woman, you would be at higher risk for having a preterm low birth weight baby. And he was just furious. And the doctor came in, and the doctor was the left-handed doctor, so that we could make, faces at each other. And I explained to the doctor over the patient, the patient was sitting, Dr. So-and-so, I explained the periodontal condition of Mr. Such and Such, and I suggested strongly that he see a periodontist because his periodontal condition is too far along for me to be doing anything. I can't do anything for this patient any longer. The doctor agreed with me, and we wrote a referral to the periodontist for that patient and his wife, who was exactly the same, right? You've seen that a number of times. The patient leaves, the end of the day comes, Shirley, can I see you in my office? Sure. One thing you probably don't know about me is that I've been on the carpet more times than, Lint. I am in trouble all the time. So I go into the office and he goes, don't do that again. I said, what? And he goes, don't talk to my patients about this link between this cardiovascular thing. We just don't have enough information. I said, oh really? Okay. I said, but this paper and that paper, he goes, that's just two. And I'm thinking to myself, veterinarians know this. Why is it taking dentistry so long to get up on the speed with this? This was early on. Now it's 2009, and we have a little bit more ammunition, and we have a lot more information, and we have backup of information. I didn't last at that office very much longer. I was there for 5 years. After that incident, I was like, I'm driving 40 minutes in traffic for this. I can drive 10 minutes in traffic for this, So that's what I did. And the office after that was the last office that I practiced in full-time clinically. Because this is so important and this is so exciting to me, I wanted to go and talk to medical audiences and consumer groups about the importance of oral health and the things that we can do now that we couldn't do 15 or 20 years ago. And then it became painfully obvious that I had to talk to dentists and dental hygienists too, because not everybody in dentistry was up to speed. So that's how I got here. This is what happened in 1998, which was just after my conversation with that particular doctor. The American Academy of Periodontology launched an effort to educate the public about the new findings which support the dental professions had long suspected. Infections in the mouth can play havoc elsewhere in the body. For a long time it was thought that bacteria was the factor that linked periodontal disease to other infections in the body. However, new research demonstrates that inflammation may be the link periodontal disease to the other chronic conditions. Very often you see reports and you see studies that say we found oral bacteria in arterial plaques. And then everybody's like, oh, it's because of the germs that are in the mouth and they're getting into your system and that's where the problem is. That's not really the problem. The problem is that we have an untended to infection. And this infection creates a cavalcade of events throughout the entire body And those chemicals that are created by your body in an effort to get rid of the tooth are what causes all of the problems. And we're going to take a little trip to talk about all of that kind of thing today. This is a no-holds-barred kind of a talk. I will not leave any convention unturned. You may be uncomfortable during this program. That's okay. You're not going to be able to practice the way that you did today ever again. You're going to feel guilty for not doing some stuff. So that's what we're going to talk about today. Dr. Tom Neighbors has done quite a bit of a lot of different things. He's a periodontist. He's in Tennessee. And he spoke to the World Congress of Minimally Invasive Dentistry last year. And he said two very important things. One is at the beginning of this talk, and another is at the end. Periodontal disease is a dynamic imbalance in the internal environment of the body. Everything that happens in the body affects the mouth. Whatever's in the mouth affects the body. And it all starts with a biofilm. Who thinks biofilm is just another word for plaque? There's no difference. It's just another word for plaque. It's not. A biofilm is a complex community of bacteria that operate in unison, and they have internal conflicts between different bacteria. It operates just like New York City. It has parts of town that aren't desirable. It has parts of town that is desirable. It lives all over. We like to call the biofilm itself a living organism. Like, I'm a living organism, so is a biofilm. And when we're talking about biofilms, we have to, and particularly on the tooth, we have to remember that we don't have a single biofilm on the tooth. We may have 1,000 biofilms with their own, each own little society all the way around the tooth. That's an important distinction. It is the most widely studied biofilm in the world, the oral biofilm. 65% of all disease is caused by biofilm, including things like cystic fibrosis. Do you guys know what they do for treatment for cystic fibrosis? They pound on your back and make you cough really hard until you... That's like really archaic. They're also starting to do more things to help get rid of that, but what makes it so hard is that it's a biofilm disease. Legionnaire's disease is a biofilm disease, so is TB, and remember what SBE is, subacute bacterial endocarditis. And periodontal disease is also a biofilm disease. This is a biofilm. This is a representation of a biofilm, to be particular. And you can see it has a special shape. This would be a mushroom shape. This would be a tower. We have some streamers up here. The center may or may not have bacteria in there as well as the outside. These waterways are created on purpose. The bacteria get together and decide, now it's time to create a waterway. The waterway does two things. It brings nutrients to the biofilm, and it removes waste products from the biofilm. The biofilm waste products are food for certain of the bacteria that live in that biofilm, and the dead carcasses of the bacteria are also food for certain other groups of bacteria. Inside of a biofilm, you not only have bacteria, you have viruses, and you have yeast and other vegetative kind of cells. So there's a lot of activity going on in this biofilm. We have stacked layers of different bacteria. So we have a different kind of bacteria that may grow down here at the base, or let's pretend that's the tooth. We have a different kind of a bacteria down here where it starts as opposed to the bacteria that live up here. The early colonizers in a biofilm are not pathogenic. They are often healthy bacteria. Chemical signals encourage the biofilm to grow. They have something called quorum sensing, where a certain number of bacteria create a certain certain protein there, that's the word. a certain protein, and that protein stimulates other bacteria to do